It is 8:55 and we are back this morning with Dr. Kira Evans from Dental Care of Baltimore, and she is now talking about the benefits of having your teeth whitened professionally for our Makeover Monday segment. Thanks so much for coming back.
Thank you.
You know, I think a lot of people use those Crest whitening strips or some kind of whitening element you can use at home, and it works for a certain amount of time, but what is the process like if we're going to come and get this done professionally, and how much longer? Would it last longer? What are the differences?
Sure. So when you come into a dental office, the first thing you're going to do is sit down with your dentist, and they're going to decide whether or not you're even a good candidate for whitening, because discoloration can actually come from inside of the tooth, from medications or even trauma to the teeth, and these generally don't respond to whitening. Also, if you have bonded restorations, veneers or crowns, these don't respond to the whitening procedure either.
I think a lot of people found that out the hard way. If you're using some at-home whitening treatments, you might notice some teeth didn't whiten. If that's the case, does that mean there's no answer for you? Can you whiten those teeth that have fillings or bondings?
No. So it's important to talk to your dentist about alternate options for achieving those aesthetic results, and really just replacing those bonded veneers or crowns that you have. Otherwise, you will see some unevening of the colors of your teeth.
How would you recommend doing it? You know, if you're going to whiten the rest of your teeth, do you do that first and then match the replaced bonding to that?
Yes. So if you know that you're going to get crowns or veneers, it's a good idea to whiten first so that we can then match the crowns or the veneers to the whiter teeth.
When it comes to veneers, I think a lot of people look at that as, you know, your teeth look perfect, they're beautifully white. Is that for everyone? How do you know if that's something that might be right for you?
So veneers and crowns are a good option, again, for having whiter. It can change the shape, it can change the spacing of your teeth. But there are some things like untreated cavities, cracked teeth, or even just gum disease or an uneven bite that would preclude you from being a good candidate from veneers.
And again, this is something you need to sit down and talk about, because I think some of the things that we have in our idea that might work for us isn't always possible.
And that's why it's a good idea, if you're interested in whitening your teeth, to sit down with your dentist and talk about your options, as well as have these cavities and cracked teeth diagnosed first.
How long can it last then? If you do go through the professionally whitening of your teeth, how long can you expect it to stay nice and pretty?
So, well, when you come into the office, we'll look at shade guides before you start, and then we'll look at what you have achieved after the procedure. Usually results, they're not permanent. This is something that people have to understand. Results can last anywhere from 6 months to 2 years, and it's really dependent upon the kinds of foods that you eat, the things that you drink, whether you're a smoker or not. These can all have an impact on how long the results do last. But generally speaking, about a year is the standard.
Coming to you is obviously our best bet, but do you think those things like whitening gums, do they actually work?
They do work, but they take continuous use for about 4 to 8 weeks to achieve the same results as you would in about 60 minutes with a professional whitening.
Sometimes it can make your teeth sensitive. Is there anything we can do to avoid that?
Yes. So again, following the instructions and using it properly is key. Not using too much over a short period of time, and not using it for too long. Also using some fluoride gels or desensitizing paste is a good way to minimize the sensitivity after whitening your teeth.
That's good information. Thank you so much. We really appreciate your time.
Thank you for having me.
Of course.